Hey guys, what is up here? Let me get on and get to sharing the screen here for the presentation. Let's get to present mode. All right, awesome. All right, so I've been actually very excited about doing this particular topic on posture because at this point I have been seeing quite a few performers with back problems, significant back problems. So, and this can be messing with just even sitting on a bus for a long time when you've been on tour and then it's hard for you to stand up from just sitting for a few hours and you're just getting that can be difficult. It can even just be doing specific dance moves that are in your show. So it's putting you in that pickle. So I really wanted to come on and just start talking about posture for you to learn more about possible causes of your back pain. And that can really go back to your daily habits, which is something you can do about it. Now, I'm guessing for a lot of you, this is probably not your first webinar. The first thing I want to mention is that if you failed ever at getting the posture of your dreams, and like emulating that perfect posture, when your mom's always like, you need to fix your posture, it's so bad. Don't worry. It's not your fault. There's a lot of information out there and it can be confusing. Many times that information overload keeps you from success, and you know what? That's okay. So if you've been concerned in the past, and you just can't succeed with your posture on your own, I want to put all of your fears at rest. You will start getting a solution from this because you can do this. You can achieve that posture. You just need the right person to start explaining things to you for you to better understand where to begin. Now, there are a lot of health corporations and businesses that want you to think that you need to have a lot of money in order to get better. There's no way for you to be successful with achieving the optimal posture and start decreasing that back pain unless you really had money. So you're kind of destined not to do well. Well, I'm here to tell you that these big corporations, these people who want to make all this money, that they are wrong. And they have their own reasons for wanting you to think that. And it's just not true. You can get what you want healthfully in your back to relieve that back pain if you are suffering from it. If you ever thought that people in the healthcare industry want you to fail, well, unfortunately, you're probably right. Because if they're not benefit, I would say specifically insurance companies, if they don't benefit from you succeeding. They benefit from you struggling and needing to come back and come back and come back. They want to keep you in debt and they want to keep you in need. It's an unfortunate situation. The difference with me is that I actually care about your success and I truly want to see you live your dreams. I absolutely love the performing arts. I live and breathe it. So I am your girl. So that's why we're here. I want you to have a dream. I want you to change the world and I want you to make an impact. And I want to show you how to make this happen for yourself. Just looking at posture alone during this webinar, which takes me to the goals. So the goals for this is very simple. I just want you to get smarter. The more you know, the more control you can have over your future. And this also, just getting this knowledge helps you and gives you the opportunity to apply it to your own body. Even if you may not be one of these specific big faulty postures that I'm going to explain to you, it may have some truth. There's maybe some aspects of the posture that may apply to your body. And overall, I want you to become a stronger performer because from knowledge, it definitely brings your whole equipment, your whole body to the next level. This webinar is for both the beginners who have never heard about posture before and the different types of faults. And this is also for the advanced people where you've been to this information and heard these kind of webinars on posture, but you may still have pieces of information that's lacking that can take you to another level for the health, obtaining the ideal healthy career. All right. And next slide. Okay, so, it skipped one. So let's just go back to here. Give me 1 second because it's for some reason not popping up on there. Okay. Let's see if we can get to it again. If I go like this, I'm going to exit out of it. For some reason, it's not going to it. There we go. And let's go. Perfect. Okay, so this is now story time. So how can I relate to you? How can I relate to you with having issues with your posture? Honestly, I've been fortunate. I've had a little bit of back pain here and there sometimes if I'm sitting improperly for a long period of time and I stand, but it's not so bad. I would actually more incorporate that with my specific body and aging. However, I have definitely experienced injuries where I was not given the information I needed to get better. And this would have to do with a sprained ankle. Now, if you're anyone who has suffered from a sprained ankle, oh, it's very common and it's awful. I was doing a show and I not only sprained my ankle, I also I strained muscles in my foot and I also bruised bones in my feet. And I was never forwarded to the right physical therapist. I just kept going to the doctor, trying to figure out what to do. And I wasn't given anything. And I honestly could have rehabbed from that ankle had I had more knowledge about the situation at hand and known where to take myself, because I would have known that going to a physical therapist in that specific situation would have definitely brought me back onto the stage faster. So this is where I'm just giving you information so you can just be more on your game for yourself. Now let's see if it goes. Great. So I have like a hair in my mouth. Anyway, it's like dull hair. Anyway, what is posture? So it's the position in which someone holds her body when standing or sitting. So just how do you hold yourself? Oh, I got it. Yes. Okay. It was a cat hair. For those who need to know, it was a cat hair. Okay. So it's when it's how you are holding your body. That's simple. That's posture. Just how you're holding yourself. So here are the different types of faulty posture that you can see. Now, I want you to look first over here at this good posture on the far left. Notice how there's still a slight curve in that lower back. For those of you dancers, a lot of times we're trying to push our pelvis forward to make our butt look smaller because we want our bodies to look like that. So I want you to just take note of that. That is actually, you want to have a calf, that curve. And here next to it, you can see a relaxed posture. You can see the abs aren't turned on. We can see everything just kind of hanging down. And then these next postures, I'm going to be going into some of them. The Lordosis, kyphosis, sway back, flat back, and round back. Let's actually get into more depth on them. But first, let's see what affects the correct posture. So there's so many things that could be getting in the way of you getting the ideal posture that you want. So there could be something going on with your bones. So the bones could have some sort of contour, some sort of weird shape that may be affecting how you are able to actually hold up your body. There can be the ligaments that attach bone to bone could be relaxed and not holding them together. So it's causing you to gain that faulty posture. So your muscles are going to have to work more and makes it much more difficult. You could have specific muscle tightness in your body that could be pulling your knees in more. So you have more of that knock knee internal rotation, just even when you're standing. And that could be just from tight muscles. You could have muscle tonus. So that's just where your muscles just always toned and it's preventing you from getting that movement that you would need. Your pelvic angle, so that's like when somebody sticks their butt out and they get more of that sharper angle in their low back. That's what, if it's a sharp angle, that could be causing definitely a big problem in your lower spine, your low back, and resulting in that low back pain. And the joint position and mobility. So this is where your bones, how they are positioned with each other. So if they're not positioned correctly, you could be born this way. And also if they're just not moving so much in areas where they need to be moving, this could result in poor posture. Now I want to pause with this, with joint position and mobility. Now for you, the performer, the actor, the singer, the dancer, the circus aerobics instructor, you're performing. Hey. So for you guys, it doesn't necessarily mean you're going to always be born this way with the joint position. You could have created habits with how you are developing Al Sacone, how you're picking up a prop on the stage and you're doing it the exact same way every day. It could be messing with, you may be getting movement in some parts of your joints and not in the others. And then from you doing that movement over and over again, that overuse can exacerbate the problem, make it worse, and even cause those areas that are not moving to not stop moving more, and the areas that are moving more. So this is a very common thing that can happen in the spine. So the upper part of your spine is called the thoracic spine. So that's an area where you want to get more of your twisting. Well, very commonly I've seen in performers, there's not so much rotation that happens here. It's all happening in your low back, your lumbar spine, where that's not where you want to be seeing it. So that unevenness between the upper spine and the lower spine can definitely result in problems. And then the neurogenic outflow and inflow is just your nerves, basically, if the signal's going. And if there are signals not going to your muscles and throughout your whole body properly, it could affect, and your body may not be getting that message to hold itself up. All right, lordosis. So that's, you can see right here, that's that butt sticking out, like I was saying, the butt's coming out. And it's just that simple. So it's just that butt sticking out, and that's going to be having a definite effect on your low back. So basically the front of your hips are going to get tight and your low back is going to get tight. The areas that are going to commonly become weak are your abdominals and your butt. This is a very, very common thing that I've seen. A lot of performers, when even doing squats, sometimes put in extra lordosis when you go down, which makes the problem worse, and it can definitely add some more pressure on your spine or even get into your hips. All right, so that is definitely one thing to take note of. As you can see in my slide here, there's a lot of other things that you could be looking at, but I'm just giving you big, big, big picture. This is going into a lot of details. Right, and the next slide, it just has a nice delay. The next slide is thoracic, so start there. So thoracic, that's the upper spine, the upper part of your spine, okay? So the thoracic, kyphosis, it's that hunchback, that curve in the spine, okay? So it's showing here, so you can see these three. These are different types of kyphosis. One is where the it's just going to be going, okay, so we have these natural curves in our spine. So the first one I spoke about, that's the easiest kyphosis to recognize, is the rounded back, which is here on the far right. Then as we, and that's pretty severe right there. Then a humpback is what I have seen in the clinic at this point. It's really not, the spine's not mobile at this point. That's how I usually associate that label for humpback. And then the last one is flat back. It's where you, like people in the military, where they're just so upright. That is also an issue with the spine, even though it's not that extra curvature that I was initially speaking about. It's still a problem because you're lacking the curvature that you are supposed to have. There is that sway in that spine in order for that proper weight distribution all the way from the skull all the way down. It's very, very important. The body it's very intriguing in that sense. And I want you to also just notice here, specifically with the rounded back and how it's, I'm pointing to it like you can see with my finger, you can see with this rounded back, look at how this push, it's going to cause this person to press their pelvis forward a little bit more. Even though the angle in which they have their pelvis is the same in all three, it's just important to notice it's pushing forward more. Okay. Whereas the humpback, it's still, I would say a little more up and down, but then it's gonna be reacting on your pelvis very interestingly as well too. It can affect your sacrum, your pelvis, hips, all the way down, especially if your spine is just not in that alignment. All right, next, so let's go into more details on the flat back kyphosis. So here you can actually see it on a person. And what I really love about this picture that I found is it's a woman, it's not some military guy doing a salute. So you can really just see what is going on here. Okay, so there is, you're losing that curve and that low spine, that curve and that low spine. And let me go back here. So you can actually see this in here as well. In the flat back, there's that lack of curve and that lower spine. Everything's just straight up and down. So you're losing that curve, and dancers, I know you're trying to do that, but it's not good. So the weak, so you're going to have weakness in your back. from this because you're pushing forward. So it's not letting your low back, actually it's your lumbar spine is not going to be working, those muscles next to your lumbar spine in your back. So that's going to be a big issue. It does get your stomach to turn on a bit more, but you need all your muscles to be able to work, the front and the back. If you have only one side, that's really going to result in definite problems. And there's other muscles that's mentioned here, but I'm not going to go into it too much other than just saying that it can also lead into affecting your scapula and therefore your shoulder joint as well, and causing issues up there. It's not direct, but it can. Everything is so connected. Then the muscles that can be overused with you pushing forward, having that up and down, the backs of your legs, your hamstrings will definitely be working more. Your abs may be working, but the back muscles still aren't going to be working that much. So, and your butt's going to be working because you got that like pushing forward, trying to keep that straight up and down thing going on. And pulling your shoulders back. Yep, you're good there. You're good there. You just can't go like this. You're just kind of stuck in this position. You know, like I said, it can affect your shoulders to be like that. And then, of course, it can affect different bones throughout your body because everything is, like I said before, it's not in that ultimate alignment. Now, what I need you to ignore here on the right is information that I did not realize I didn't delete. That has to do with another lecture that I have for you guys, but whatever, ignore it, it's fine. Okay. Now going into the humpback kyphosis. So this is going into more depth of what I was saying before. This is just where you can see the picture. Okay. When somebody has this, it can be extremely limiting. Now, when you, as a performer, when you are in rehearsal, this is where you need to watch out because this right now for this person, the ligaments connecting in the back of his spine have elongated so much. He doesn't have that support there. And he's been sitting like this for so long. He's now stuck. You need to be careful. It's for some people, it runs in the family and everything, but it's actually from your habits. So you need to pay attention to this. It's easy to feel, whatever, I got bad posture, but I'm telling you, you do not want this unless you're going to play the Hunchback of Notre Dame or of non-traditional casting. You'll be the female playing the Hunchback of Notre Dame. So yeah, be careful. Be prepared. Waiting for it to go to the next one. All right, now going into more depth of that round back kyphosis. So what's really interesting here is that you're going to have your head coming forward more in this position. And your back, it's like, one second, let me try to, it's like this and like this. I'm bringing my arms forward to kind of give you the idea. Okay, so we have this going on, and then so you still have that increase, that rounded back, but it's not that humpback like this where it's bringing forward, but it's like this. Oh, it's hard to do. And from here, you can see that there is still the hips are coming forward. The hips are flexed. The knees will be pushing back at this point, like hyperextended to kind of help maintain that balance because of what's going on up at the top. Okay. And then for muscles that are very commonly elongated and weak are when your head is forward like this, right here, the front of your neck, these neck flexors become weak. Also, your abdominals become weak. Your muscles up at your thoracic spine, your upper spine become weak. All right. So, and if you're like this, the muscles in your back, because they're elongated. I'm spreading apart. I'm bringing my scapula apart like this. That becomes weak. This becomes tight. Okay. And when your head is forward, now going into muscles that are strong, it's okay. I need to pause here. When I'm saying strong, I mean, it could also be overworked. Okay. Overworked. So you need to keep that in mind. So this back here, the back of your neck, is going to be overworked. The fronts of your hips, of those hip flexors, that's going to be overworked. And like I said, this front here, your upper abdominal muscles, because we're curving forward right up in that area, that's going to be overworked. All right. And then also the muscles between your rib cage are, especially in the front, are really going to be closer together and causing that tightness, getting them to stay in a shortened position. And of course, this will be affecting different parts of your bones as well. So you can see so much can happen from this poor posture. Okay. And this could just be from how you sit, how you feel comfortable, how you look at your phone. Okay. And then this is kypholordotic posture. Man, was I hesitant to put this one out. But this is actually, so kypho, so that think of the upper back, that curve, and then the front of your hips, lordotic, that's your butt coming back. So it's two things at once. Oh, so just like I was saying before, I'm going to sum this up hopefully a lot faster. So we have the head forward. So right here is going to be weak. The back's going to be overworked. We're curved like this. Tight, weak. Weak, 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 okay? And then we come down here, the hip flexors are going to be tight, your low back is going to be tight because your butt's out, your butt's going to be weak, those hip extensors, that's going to be weak, and your abs are going to be weak. And so it's like the perfect storm to have something like this. It's where do we begin? Okay, so if you have somebody take a picture of you, if you're wondering what your posture may be already, just make a deal maybe with a friend and be like, hey, take a picture of me when I'm just standing and when you don't notice. You can't be aware that they're taking a picture of you. And so that way you can get an idea of where you may lie in the spectrum. Okay, and so here are just more pictures of the different types of postures where it could be a combination of things. You can see here on this woman, so it has a lordosis and kyphosis, so you can see the combination of the hips and the upper spine. Same thing here. All right. And ignore this, it's just the dowagers. There's names for so many different types, but you get the idea. You get the idea, which is very important. Okay, so I just wanted to acknowledge these two types of posture. So for the picture on the left, so I just want you to really see the red dotted line that's going straight down. So we're seeing that there's the lordosis, right? That's the butt going back. You know, we have that extra arch going on. But what you need to see here is where the line is running through with the spine, this vertical line. So you can see here, it's just the lordosis. But then with sway back, we're getting, see how far back that upper spine is, how far behind it is from that dotted line. That's that sway back, okay? All right, and here's another picture of the sway back. Now you get that idea because it's, hard to differentiate. So we have the sway back here now more traditionally, and this is where the person is pushing their butt forward, okay? So sway back, and it's tucking the hips. You know how in dance class, you sometimes tuck your hips in order to get more of that external rotation, increase your turnout. That's what you're just doing standing all the time. This is something I've definitely seen in a lot of dancers because you're trying to get that flat back going all the way from your head all the way down to your feet, so it looks like a straight line, and this is what you're doing to your pelvis. This is a combination of what's going down at the pelvis in addition to what is coming up to your higher part of your back. Now, I'm gonna do a big picture thing since I think you might be getting it. So since we have this going on, we can see that the head is forward a bit. So you can see, same idea, weak, overused. We have this sway here, so tight here, weak back here. You guys getting the idea? Now, since we're pushing forward, actually, your hip flexors are going to be elongated and your lower back's going to be elongated, while your abs and your butt are going to be shortened, okay? So the idea is that you're starting to get the system, how things work. If one area is forward and everything is on slack and not having to work, that means the opposite side is going to be overworked. I click the next arrow and fill in time there. Thank you so much. Okay, so So scoliosis, okay, ignore these words, okay. Scoliosis is where we have that curve of your spine, that curve of your spine. Not everybody has this curve. Sometimes people have a small little one, or I think my friend told me that it's a curve on my back, blah, blah, blah. So what it means is it can get to a point where it's so much where you need to start, getting physical therapy. If you have a curve like this, so say this is my spine and the curve is here, okay, like this, the side, what you want to do is you want to go like this. You want this side to open up and this side to essentially like kind of close down and shorten, because the muscles on this side are going to be elongated and the muscles on this side of the curve are going to be shortened. So you want to stretch the muscles on this side and you want to strengthen the muscles on this side. That's it. That's big picture. There can be other things going on with the body and stuff. You definitely need to work with a physical therapist, but that is the idea, the big picture idea of how scoliosis can be handled. But it is different for everybody, so don't just generalize for yourself. I just thought this was a very interesting thing. In the book that I used as a reference, they used Thoracic, which is where it's found in kids. The head starts tilted here, and then there's a rotation like this. And they refer to this as a type of scoliosis and having to do with the curve in the neck. So what I thought was interesting here is that it can actually even come up to your neck, some sort of curvature or anything. Honestly, if you have some sort of postural thing going on here where your neck isn't aligned, it can definitely affect all the way down, side to side, front, back, rotating, all that kind of stuff. All right, that is it, guys. That is all my information that I have for you right now on just like all these different types of postural ways incorrect ways to hold yourself up in your daily life, okay? You need to start acknowledging this now. Now, this is my favorite suggestion. That's a quick exercise, I guess. It's not weightlifting, but that you can already start doing now. I'm using a book of mine, all right? And this is when you hold your phone. Because we're on our phone all the time, guys. We are on our phone all the time. So what I want you to do, if you're on the subway, if you're waiting at the doctor's, if you are standing in line at the grocery store, don't hold it down here. I want you to feel almost embarrassed by how high you are holding your phone. It needs to be like you're taking a picture of someone. If it feels like you're not about to take a picture of someone, it is too low. But if it does, it is the perfect height. All right? That is it. If you have any questions or need any guidance with your own posture, feel free to reach out to me. I definitely do free screenings to help you out. All right, take care. Bye.